We thank you for being here. Before I pass the mic on to Dr. Meera, I would like to share a small introduction about her. Dr. G. Meera is the medical director at Sri Hariyam Ayurveda, where she successfully practices along with her husband, Dr. Sudhir, who is an 8th generation Vaidya. She is also the only woman elected director at IMCOPS Chennai. I was so elated to read that. Very, very honored to have her here with us. She is the first doctor to have done telemedicine in a COVID ICU at Anand Allopathy Hospital, along with Dr. Sanjay Jain, Chief Doctors at SRM Ayurveda COVID Care Center with Dr. Veerachoran and Dr. Satish Gattak. She is one of the very few Ayurvedic doctors who did telemedicine for COVID, and she has documented 250 cases and treated at least 3,000 cases in her clinic. Along with her family, she has served 25,000 villagers in and around Uttiramerur in 2019 with Ayurveda immunity boosting herbs following the center's COVID preventive protocol. All of these efforts have been well documented by the Tamil daily Dinamalar. In continuation with her passion to practice and preserve Ayurveda, her clinic, her practice historically honors 33 Ayush doctors through their Jnana Varshini Trust, through His Excellency Thiru R.N. Ravi, Governor, Tamil Nadu. This event happened on December 14, 2023. This decade-old trust also caters to medicinal needs of the Irula tribals from villages in and around Chengalpet. We are very, very proud to have a multifaceted, multi-talented personality as Dr. Meera here with us. How do you play it? Share screen. Slideshow. F5. Slideshow.
Namasabaya. Respected dignitaries, Mataji, various bhaktas of this great Veda Patasala, and Yogi Ji's Shishyas, friends, dignitaries, you would have all had a heavy lunch, and the sugar shoots up after your lunch, the kapham increases in your body, the ideal time to go into a sleep. The tamo gunam increases. What does Ayurveda tell about day sleep? It does not recommend day sleep, but which we love to do. We can't stop ourselves from sleeping. Ideal to take a nap in the sitting position, that is in what position you are all in, and not to lie down. That is what Ayurveda recommends. After having your lunch, walk for 1,000 yards and sit and nap for a few seconds. That's not going to cause any disease. So the topic given to me is new perspectives on science and technology in ancient India. As Mataji was explaining yesterday, after they had conducted 3 conferences in 2007, after which they could not go ahead in conducting these conferences. And she also told how Yogi Ji had predicted that in 25 years, the Vedic science will become so famous and so prominent in the world. Probably we are reaching that phase. 2023, in 3 years, we can look forward for more magic from the Indian sciences. That is why probably IIKS, Indian Knowledge Traditional System, has been even born and conceptualized in IIT. What are the new perspectives? Before going into that, have we understood the existing perspectives? We always want something new. Whenever the patient comes into a clinic, because you know the Ayurveda is so ancient and old, you have very moderate appearing clinics, no fancy, glass doors and white-coated physicians and nurses and front offices who answer your call 24 hours. So whenever the patient walks in, they ask, what is new, doctor? I'm very sure Ayurveda would have got advanced in all these 20, 30 years. I have a leg pain. How are you going to cure me of? If we had changed our approach, we wouldn't have been able to treat COVID. If we are going to change the approach, we will not be possible to approach any epidemic which are going to come in the next decades to come. We cannot change. The Ayurveda's approach should not change. But the understanding of Ayurveda, the perspectives which we have shed many of the existing perspectives where we had gone into the shelf and not accepted anything Indian. And such perspectives have started to change. Today is Tiruvadirai. I know many would have celebrated and taken the blessings of Lord Shiva and Parvati at your home. This star is very, very special star because it was the star in which two gurus were born. Can you name them? Tiruvadirai star, the two gurus of India, prominent gurus were born. Sorry? Ramanar? Okay, I'm unaware. Next. Two main who were even very, very seniors to them thousands of years ago. Ramanujar and Adi Shankaracharya. Can you tell me the date of birth of Swami Ramanujar? It is Panchami, Shukla Paksham, Tiruvadirai and Vishakamanth or Chitrai. And the birth star of Swami Adi Shankaracharya, Panchami, Shukla Paksham, same by Tiruvadirai and Vishakamanth. You will have the Advaitis praying to Adi Shankaracharyas here and Vishishtadvaiti praying here. Have we been together any day? Do we even know this? Do we even recognize that it was the same cosmic power which had taken birth at two different phases to take care of us? No. Probably this is the first time you're listening to it, right? Yes. It has hurt me many times, understanding how we've been taking different paths without knowing the purpose of why we've been born. This is Tiruvadirai, and in 2-3 months we are going to get both the Advaitis and the Vishishtadvaitis birth star, and we have to sit and think as to how we are going to proceed. Yogi Ramsuratkumar, I'm not a disciple of Swamiji. I've heard to many of his experiences through his books and writings. Last year, when my father had left this earthly abode, I was in a sort of depression. When on February 20th was my father's anniversary, death anniversary, means the 10th day function was happening, and it was Yogi Ji's also anniversary at that time. So what I work for gurus. You will find lots of videos of mine about gurus of India. So I thought I will just work on his life history and just prepared a video and posted it. I would have got hundreds of calls from Yogi Ji's Shishyas. There was one doctor also who had called me. And while I never knew who was Yogi Ji. Am I discussing spirituality in a scientific session is, IIT has started working on spiritual concepts, which is an unimaginable thing. Can you imagine scientific researches which are going to be made on this Vedic science? Yes, India has entered into it. So, Atma Gunas, what is a soul? Is it possible to do researches on what is Atma and what is Manas? We would have gone through many experiences which are called deja vu, right? And many coincidences which match with these things which happen in the cosmic field, like the Tiruvadirai star. Why should two saints be born at two different times and propose two different concepts to understand the Vedas? We believe that the star and the powers manifest different living creatures with the same, living beings with the same nature, right? So these are difficult things which we have to do, which I think India should take steps to do research on. So when the doctor was speaking to me, he was discussing about his experience with Yogi ji and how a butterfly would manifest whenever the doctor traveled, and Yogi ji would bless him with a butterfly which would travel with this shishya of his. So it was my first call, and as he was speaking, I would find my 9-year-old daughter who was not well versed in drawing. She would start drawing a butterfly. So I was touched because I was in pain after my loss of my father. I would discuss it immediately with the doctor on phone. Although you're so scientific and you're a researcher or you're a doctor, you get moved by such things. So as I sought Yogi ji for 2 months, I would start getting many more such coincidences, if you're going to tell in scientific terms, or blessings of Yogi ji. It went to a level that I would enter too much into Adhyatmikam, and I would myself stop because practicality is different, and I would start seeking Yogi ji. Last month when we had done this conference at Raj Bhavan with the hands of Governor R.N. Ravi, we had felicitated 33 Ayush experts, which was a historical moment. I was very upset. I missed my father, and I wanted some positive sign from the cosmic force. Can you imagine? There was a mail from Veda Patasala from Yogi ji inviting me to this conference. I thought it as a blessing from this cosmos, these silence messages from the cosmos, which is what we've been discussing since yesterday: Indian astronomy, Indian mathematics, today is Indian chemistry and Ayurveda. These are subtle messages which you keep getting from the consciousness. These are what we are trained for, the Vaidyas. I still remember in 2019 when the world was speaking about COVID, we would find guduchi, that is Seambilcodia, Tinospora cordifolia, suddenly growing in much quantity in our clinic. We were surprised, why did this guduchi grow here? Because we had just planted a small sapling. In January 26th, we will get the recommendation from the Indian government to get prepared for COVID, and the first herb which was written was guduchi or Tinospora cordifolia. The plants which have to take care of you grow in your own kitchen yard. We don't have a kitchen yard and space. We have got disconnected from the environment. That is the first problem. We had many queries from the public asking the doctors, "Doctor, have you done research on this? Doctor, have you done research on this?" I would like to question you back. What have you done for the Ayush system? Have you all not been born in this country? What have you all done for the Vedas and Ayurveda? I'm not being disrespectful. We have been out of focus since 70 years. Let us accept. We don't know the purpose of the Vedas. We don't know the purpose of Ayurvedas. We don't know the purpose of Indian medical sciences or Indian sciences. The purpose was to understand the cosmos, and the only purpose of life, shall I tell you what, is to live a healthy life. Nothing else. Nothing else matters. Not this conference. Nothing else matters. If we are going to sit calmly, eat wisely, do some yoga, take some herbs, we are going to be healthy for 120 years without getting attached to the kama, krodha, lobha, moha, mada, matsaryam. Simple life, right? But why are we struggling? So I wish IIT also takes up research on understanding what is a soul. It is possible. I was speaking with researchers who have already started working very much on how to decodify and how to represent the body model with the help of science. I'm very happy. I would also recommend them to start working on how to depict the Atma and the Manas through depictable mechanisms, through physics and physical means. I know it's a challenge, but the parameters have already been told in our textbooks. So before going into perspectives, I would love to share what all perspectives are we going through. There was a question of a friend who had asked, what is the difference between Ayurveda and Siddha? What system should I take? Before going into it, you should understand that Indian traditional medicine has been now codified and has been brought into one umbrella, which is called as Ayush. You will find this word everywhere. Ayurveda is A, Y for yoga, U for Unani, S for Siddha, and H for homeopathy. This is the term Ayush. The government is looking towards working and enhancing the doctors under this system. In the Tamil, there is a politics between Tamil and Sanskrit. Sanskrit believers and people who practice at one point had even told that Sanskrit is more important than traditional languages. There was a fight and there was some misunderstanding, just as our starting point is Swami Ramanujan and Swami Shankaracharya. They had to play their roles during those times, as simple as that. It doesn't mean that they were at any conflicts. We have to understand that. Similarly is Tamil and Sanskrit, Siddha and Ayurveda medicine, they are one and the same. They have been proposed by the same rishis. Agasthyar, who is Agasthyar? He comes in Atri Gotram. Agasthyar, he is also called as Kaundeya. You will find his birth in Varanasi. He comes here and writes, he codifies the Tamil language and he writes all the Tamil texts on medicine. There are 18 Siddhas. There is no difference between these 18 Siddhas and the rishis across India. They followed the same lineages. They were people who were traveling across India. You will find Atri. Atri's ashram in Tamil Nadu, near Papanasam, and you will find an Atri's ashram in Himalayas. At two different places, how was a single person? The Gotram. Across generations for thousands of years, as simple as that. You will find different references of different rishis. They all had the same lineage. They will speak in Tamil, they will speak in Telugu, they will speak in Hindi. If born today, they will go and speak also. You will find a French Vaidya also with the same Atri Gotram. There's no need of confusion. So, Ayush ministry is now headed by Sarbanand Sonewal ji, and we are just making a beginning after 70 years. Since 5 years we had an Ayush minister and now we have a new Ayush minister. And there are no state Ayush legislatures. You don't have an MLA for Ayush. Unless that manifests in every state, at the state level, at grassroots level, the policies of the center will not work. That is one point. What is the missing link? Why do we all feel that there is some lacuna in Ayush? You know what? There's something which is missing. Why have you not done this research? Why are you not able to fit into the Western? So many questions, and you put across the questions to the same person, Dr. Rama Jayasundar, Dr. Girija. Dr. Girija, why didn't you do this? Dr. Sudhir, why didn't you do this? These are physicians, for your understanding. They have done all these researches out of their own pockets. None of the government have funded it. So this is what is the situation in India. There are private practitioners of these systems who have to take care of their livelihood, the society. They have to make records and researches, which is a challenge because the system has not been properly developed, but the center is looking towards developing the system. Budget perspective, as Madam Girija had put forward, 97% for allopathy and 3%. She's my guru. She was a little bitter that the government is not taking care of Ayush. I would not blame the government. The problem is with the media and the public. How much of demand? If you are getting, I don't want any epidemic to come. If an epidemic comes, how many of you will demand that I want to get treated by a pure Ayurvedic doctor? I will not even ask you to raise your hand. I know how many would. There was only one Matadipati from Karnataka who registered and who put up a strike with the Karnataka government telling that he will only get treated by Ayurvedic medicines during COVID. He was jailed. It is not the mistake of the government. The media will thrash you. The media has never been supportive of Indian medicine. When has it been supportive during COVID? Now it has changed. That is different. Now the times are changing. So how many of you will have the guts to go and take a prescription from an Ayush doctor? You don't know the system, right? It is because we have the education level, we have not been taught what is Ayurveda. Because the basic question, what is the difference between Ayurveda and Siddha? It is the same Rishi, the same lineage. There's no difference except that it is written in Tamil and this is written in Sanskrit. There would be difference in numbers. There would be difference in the way you understand. But it's all the same. So look at the beauty. This is what the World Health Organization tells. 80% of the population in India is dependent on Ayush medicine. But the budget which it has given is 88,500 crores for allopathy and 3,500 crores for Ayush. What can we do with this 3,500 crores? Even for the 130 See, we get 1.5 lakh crore as GST every month. We don't want to get the share of allopathic medicines. Let them. The system should also function. You have to improvise emergency medicine. Let 88,000 crores be for allopathy. We also need 88,000 crores for Ayush. That should be the way we take across, where the government is looking towards it. Perspective of choice in science. Even the researchers in India, IIT, DST, we have made thousands of researches on herbs, but which were never on the Ayurvedic way since these past 50, 60 years, as even our scientists were unaware of Ayush till COVID came in. Till COVID came in, they were unaware of. There were very few researchers. There are beautiful researches which are done by the MD and PhD scholars of Ayurveda, Siddha, Unani, Homeopathy and Naturopathy, which are still being not documented by the. So there is a parallel research which is going on in India at different spots. We have to link all these together, then we'll not be repeatedly spending money also. So these are the things which the government should look into it, and I'm very sure they are looking into it. So what are the pharmaceutical perspectives? When Dr. Giri ma'am was asked the question, what are the developments, what are the steps which are being taken to produce more herbs? We must all do it. How much of us are taking interest to grow herbs in our place? Or go and get a prescription from an Ayush doctor? There is no demand. We have the same set of patients who come to our clinic. Okay, so this is all a clinical practice. You don't find giant hospitals in Ayurveda as allopathy. Why? What happened in 70 years? When after the independence, immediately we, our forefathers, you and your forefathers, we all together immediately started constructing and contributing to allopathy system of practice. We started from our own kings. Our own kings had patronized allopathy from the start of 20th century. We have references for that. Saraboji invited Western. So it is not a time when we tell a no to Western science. Given an option, would you take a bitter decoction for 3 times a day or a white pill which is tasteless? You would always want a tasteless pill than a bitter medicine, right? So let us not find the blame game, but we completely forgot patronizing Ayurveda. How many allopathy institutions have we built? I find many of my relatives and family and friends writing off their whole wealth to allopathic institutions. How many of us have written their wealth to a Patasala or to an Ayush institution? An Ayush system, you have to understand that it was not just practiced by Brahmins. Of the 63 kalas, 63 ஆய கலைகள் 63 இருக்கு இல்லையா, அதுல வேதங்கள் 1 இல்ல 4 ன்னு வெச்சுக்கோங்க. All the others were practiced by all other parts of the society. The Brahmin, the Kshatriya, the Vaishya and the Shudra all had the right to practice Ayurveda. It was never meant to be practiced by the Brahmin. That is the rule, and that was how it was even till the 19th century, because we have the references of how potters had done plastic surgery. You would have all listened. You can go and look into the website. How it was a potter who had mended the nose very casually. How much would you be paying to a facelift now? It could be few lakhs. What did the potter do? What money did he get? So the Indian system was itself in such a phase where none of our services was measured by money alone. Money came in later. We immediately start putting the blame game on each other. Money came in later, in the later past century. Before that, it was just the services. You would be respected for your work which you do. What have we done to the potter? So the whole system of the techniques were taken from the Ayurveda doctors. The potter did his plastic surgery. It was carried over to Royal Society of London. They published a paper. The physicians picked up the technique and started doing plastic surgery. How was the potter felicitated? What was India paid back? We are going and planning to get back our Kohinoor diamond. We'll get back the money. How will we get back our skill? We have not patented this skill. This problem is existing even now. Why am I discussing with you? You are the ambassadors of Ayush. You are born in this country. You are the ambassadors of these rishis and sages. Now the same problem is there with Kshara Sutram, which is called Karanol in Siddha. It's a beautiful surgery where parasurgical procedure where you use just a thread to heal a fistula in anus. This technique is being taught to even allopathy doctors from BHU. They get trained. I tell the policymaker should be very clear. When you teach a technique from Ayurveda or the Ayush systems to the other systems of medicine, you have to be paid back. Because you have been given 88,000 crores in the budget, you give us menial funding and you also take away our skills. You understand this is affecting the livelihood and the quality of researches of Ayush which is taking place in the country. So these apart. So doctor was asked, what are the developments which are happening in the Ayush system? Yes, there are many efforts which are being taken by the scientific community and the center, which I am sharing now. It so happens I am the director at IMCOPS. The turnover of IMCOPS was at 35 crores and after COVID, since 4 years, it has become 55 crores. So we are clapping here for COVID. It was due to the sales of Kabasara Kudineer and Nilavembu Kudineer. And the institution is expanding from Tamil Nadu to other states also. 55 crores. You all know how menial it is when you compare it to the profits of what remedies were made in just a year for a medicine which was banned, for a medicine which was never accepted by the World Health Organization, for a medicine which was still being written by all allopathics across the world. The unity with which the system works is commendable. So it was $1.5 billion was the profit of a short period of few months sale of remdesivir, while IMCOPS is at 35 and we are going at 55 and we are planning to move it to 100. So how shall I make more profits from my company? Shall I increase the cost price of my drug, which the common man will not like? The pricing of Ayurveda drugs, you will come and tell, Triphala, right? It just looks like a powder. It just looks like a rasam or a sambar powder. This is the common man's thought process. Why should I pay? Right? This is not the case when you are given a vitamin pill for 150 rupees, when you know that you can get it for 10 pies. These are the issues. Now, pharmaceutical perspectives. This is IMCOPS. A short video. Volume increase பண்ணுங்க. So this is in Mylapore. This is one thing which as Indians we must all be proud of. This is the first cooperative in India. Cooperative society in the whole of India. It was started in 1944. Who had started it? It was an allopathic doctor who started.
The Indian
Captain Srinivasa Murthy was an
cooperative pharmacy
allopath.
and stores.
An allopath, a military doctor. So this is the place where asavas are manufactured. This is a small lab. We have 100 kalvas at IMCOPS, which is the maximum in the whole of India. All procedures are done as per textual process, and of course modernization is there. Kashayams are prepared, tablets manufactured, oils are prepared, tablet rolling machines. From handmade it has become machines.
IMCOPS, the Indian Medical Practitioners Cooperative Pharmacy and Stores.
So we are also trying to take it across India and we are expanding. So what are the work we do at IMCOPS as a largest cooperative society, the first in India? As I told, it was started by an allopath. Why did this allopath start this? It's a very interesting story. He was a military doctor and he will find that during the World War, he will find that the army people, after having the fight, their wounds will not heal. And all the antibiotics and all the medicines we would run out of stock. So he will immediately, his father was an Ayurvedic doctor. They came from a traditional Vaidyas. He will take all the books, make references and start preparing pills, and will immediately start also proposals of starting a cooperative society. That was how it was started. So without starting for just Ayurveda, he will also include Siddha doctors and Unani doctors. Unani, around 1,500 medicines are prepared here. So look at the vision of that allopathic doctor even long back. So Dr. had also asked Girija madam as to, do you have references of flu being treated in Tamil Nadu? It was asked by Dr. Ramanathan sir, yes. So we have documentation of flu being treated in India. One, a very casual entry made by Rabindranath Tagore. He had written a letter to, I don't remember his friend, where he would tell how they would treat flu with the help of Panchatikta Kashayam. He will tell how the hostel students at Shantiniketan did not get any fever or cold, while the hospital would be full in nearby villages. That is one record. And another very, very important record which we all don't know is Achanta Lakshmipati in Chennai. He was also an allopath. An allopath would give away his allopathy degree in the 1940s because the government would pass a rule, the British government would pass a rule to remove the degrees of Ayurveda doctors, to remove the degrees of Ayurveda doctors. When that decision was made, Achanta Lakshmipati would give up his allopathy title. He was from an Ayurveda Vaidya family, and during flu, it is recorded, we get it in Google, he will start giving Panchatikta Kashayam and Triphala to all people around in Chennai. And he has also donated his land in which VHS, Voluntary Health Service, runs its research institute. So these were Vaidyas, these were allopaths who stood for Ayurveda. So this IMA should have in mind, because IMA is still catching a red flag and is not for integration, and the government is finding it very, very difficult. So what is happening in IMCOPS? IMCOPS is a quasi-government. It is run by the center. We have a turnover of 35 to 55 crores. There are 1,500 ASU products, 28 depots across Tamil Nadu, Andhra Pradesh, Karnataka and Kerala. We are focusing to expand in North India. Standardization and modernization we are trying to do as much as possible. There are many chemical tests like ICP, AAS, and many such parameters which the researchers are trying as to how to standardize. It is a big process. It's not going to happen in a single day. And talks with IIT Pravartak are there for patenting sensors which were worked at IMCOPS. There's another struggle which we are going through. I will share it with you. Deer antlers. Okay, man kombu we tell, right? So these deer antlers have got very good medicinal property for heart attack. It can prevent heart attack. It has got lots of calcium and minerals in it. But this is very, very effective for cough, wheezing and all things with your respiratory system, which was in practice. Now with a ban on animal products, we are unable to get these deer antlers. Now how do we get these deer antlers? It's not by killing these antlers. You would have all seen in BBC and NGC how these deer lose their antlers during the time of mating, and during cold seasons the antlers just fall down. The horns just fall down just as hair falls. So you will have kilos of these horns which are collected in the forest. So almost for 10 years, the president of IMCOPS, Dr. Kannan, and all the Siddha and Ayurveda doctors in Tamil Nadu are struggling. They are writing and they are going here and there, writing to officials, requesting for enabling us to give these antler horns. So it is a big challenge because you have to change lots of, the legislation has changed, the forest officials are hesitant, you have to get orders from the center. In the Rajya Sabha and in the Lok Sabha also, we have made the MP, Dr. Ganesha Murthy, a DMK MP, has made his point. So how does it come into practice? Only when we get mass requests from the public, right? So, or there is a media activation, or when the people keep asking that it's a very important necessity, do you legislate something, right? So for now it is going at a very, very slow speed. So where is your role in this? We are struggling for this. How are you going to help us? I leave this question to you. You all we all made a hue and cry during when this Jallikattu was stopped, right? I was expecting such movements during COVID, but the people were all afraid just in their homes. Not a single person asked that Ayush be made the main protocol. So till public wakes up, the government cannot do anything. So we are also looking for enabling veterinary medicines through Ayush. Disease perspective, what are the changes in the disease perspective? So when Ayush striked, as we all have discussed, World Health Organization very clearly told it does not have a medicine, and our allopathic friends would repurpose existing antibiotics. It was a dream come true for many of the Ayush doctors because we were waiting for this moment, and we are thankful to the central government to have enabled us practice during COVID with at least mild and moderate cases. So we were enabled and we have documented these cases. All the emergency cases which we are discussing here were those things which could not enter into the allopathic ward because of lack of medical support. So these, we have treated 20 cases of hypoxia, which I'll be discussing with you all now. So this is the protocol, and I will never ever forget this, because this protocol was prepared by the topmost Ayush doctors. The task force was made, which had Dr. Grija, which had Dr. Alien doctors, cortical doctors. These people were all, Dr. Shivaraman from Siddha. They were all invited, and the Prime Minister had a video call, and they all sat and prepared this manual. So this is one manual which we will never ever forget. It had all medicines, even which we could give during the emergency. Not that these were all unknown, but this is one statement which we have made to the world, that Ayush doctors can treat COVID. So what is the problem? Why could not allopaths not propose a medicine while Ayurvedic doctors could propose a medicine? So this is one concept which we all must know. The germ theory versus the terrain theory. So, sorry. So the perspective of how an Ayush doctor looks at a body is different, and how an allopath looks at a body is different. An allopath will never write a prescription unless he finds evidence from proper researches. That is what, or from the text. That's not the case with Ayurveda. From the day one, we are taught by the rishis through the shlokas that this plus this in this condition you can give when the kapham is more. Or this plus this when pittam is more. For this constitution, you can go into this combination. If this organ is affected, you can go for this combination. And never was germ a focus. It is only with the Tridosha theory. When Vatam is more, when Pittam is more, and when Kapham is more. So when it was COVID, we understood that it was a Kapha Vata condition which was affecting the lungs. The patient had fever. So we knew what were the medicines for fever and what channels were affected. It was the Rasavaha Srotas which were affected. So for Rasavaha Srotas, you have this and this medicine. So immediately, even a doctor in the last Rameshwaram could write a prescription if it is a new epidemic. Because the Siddhantas, the protocols are laid in the text. So what's the problem? Germ theory, what does it tell? When you get infected by one virus or a bacteria, this bacteria or virus, if it is potent, can kill you. Right? That's not the case with what Ayush system. Of course, we have Krimija Rogas. We have the Vedas which explain about what is Pishacha. Pishitam ashati iti Pishacham. That which eats your mamsam or flesh is called, can be called as Pishacham. Probably these Pishachas are microbes. We are not going into that. Ayush system only speaks about the Tridosha Siddhantas. So when you have this dosha which is in excess or less, manage it with this prescription. So this is what is told. So there is another theory called the terrain theory. So the germ theory was proposed by Louis Pasteur, and the physician or the chemist who worked with him, he was called as Anthony Bisham, who told that terrain theory is a theory which is important in managing a disease. So what was the germ theory? It claims that fixed species of microbes from an external source invade the body and are the first cause of infectious disease. The concept of specific unchanging types of bacteria causing specific diseases became officially accepted as the foundation of allopathic medicine and microbiology in 19th century Europe. Also called as monomorphism, it was adopted by America's institutions which began to shape near the turn of the century, which we all accepted, thanks to Saraboji in the south. This gave birth to two main industries, vaccines and antibiotics. See, we know that when we make pickles, right, we add preservatives so that you are going to take off the disease-causing agent or the thing which is going to decay, right? So that is one thing. But what if you're going to cut off the air, like we have vacuum-packed dishes, right? When you're going to cut off this thing which is going to cause the disease, then the host can have its own defense mechanism. The defense mechanism is preserved. So there are different ways of looking at the same germ theory. The opposite way was how Bechamp looked at it. Our bodies are densely populated with microorganisms. This is what even modern scientists tell. We have 300,000 species of microbes in our body. We are nothing but a collection of microbes, right? What inhabits us do not hurt us and is essential to us. We live in a symbiotic, mutually beneficial, mutually necessary relationship with a personal population of microbes. This is what his own student would tell. So there was a struggle between these both, and we will have Louis Pasteur winning, and we have accepted this. So the scientific community has not even argued what could be the drawbacks of the system. For example, during COVID, how much of the population died? How many of them went into ventilators? How much of the population? 0.1% were those who were ventilated. Of 100%, it was only 0.1. So it is always so in most of the diseases. This is the data which we have. COVID-19, symptomatic were 25%, asymptomatic were 75 to 95%. Those who were severely affected were this 0.1%, and 1% could come out with an MODS. Okay. In swine flu, again, 75% are asymptomatic and 25% are symptomatic. Polio, 1 to 5% are symptomatic and 95 to 99% are asymptomatic. So it is the weakest who have the least immunity. That 0.1% is the one who is getting affected. So which means we all have very, very good immunity. In the whole family, how many of us fell sick and how many of us came out? In the whole of your city, everybody would have got COVID, right? Not that every family had a death. It was not so. There were many deaths which were unnecessary due to unnecessary medications. So dengue, again, 80% are asymptomatic and 20% are only symptomatic. It is only this, we are worried about this 0.1% of population. And so this is what is immunity. This is what is the terrain theory. Our terrains are good and it's only a very small percent of population which is getting affected. It is in most of these epidemics. So the researchers, when we go ahead, we cannot frame research protocols based on Louis Pasteur's theory, but that is how the researchers are being framed now. We have had 170 to 200 research papers from India, from various scientific institutions, with various extracts of herbs, active principles of herbs, which were very active in inhibiting these viruses, which the actual Vaidya does not accept as authentic Ayurveda. But we have no choice but to travel with these principles for now to make a statement with the Western world. It is only because of these efforts that GCTM, Global Center of Traditional Medicine, has come in Jamnagar for Ayush system alone. So this is one thing which as Indians you all have to be proud of, and you have to follow the how this GCTM is going to come up, because this is the first country, because traditional medicine is being practiced in all countries across the world. South America, you have Africa, you have in Australia and England, even in Europe, there are traditional medicine practitioners. But India is going to be the mouthpiece of the traditional medicine, and that is why GCTM has been formed in Jamnagar. So going ahead, we cannot stick on to Louis Pasteur's theory. We have also to examine and Bechamp's theory and frame our researches. So I'll be sharing a case of how we treated a COVID hypoxia. This is one of the least hypoxia which we've recorded. We had managed 20 cases of hypoxia from home only through telemedicine. These were all people, friends and relatives, and people who could not get admission in an allopathy hospital. This has been published in Science Direct. So it's the first known documentation of a COVID patient in ARDS, acute respiratory distress syndrome. His respiratory rate was at 44. And MODS, where all his organs were in failure when he reached us. He had fever, body ache, and his SpO2 was at 56. See, the World Health Organization had given the rule that people who had oxygen parameters lesser than 90 should be admitted. While After the 3 waves, even at the end of the 3rd wave, allopaths themselves started telling that from 85 to 90, please don't come to the hospital. So how many of the people were admitted at 89 and unnecessarily treated? God only knows. So Ayush doctors never get carried by the numbers. Even you should never get carried by the numbers immediately. When you fall sick, when you all had a good feast now. If you're going to go and test your sugar levels, it will be at 200 probably. If you're going to take a walk, it will come down by 20 to 180 if you're an old age person. If you're a healthy person, it will be at normal level. So when you're getting old, the sugar levels may spike for a little longer time and it will come down when you're going to, and if you're going to have a fever, it will show at 220. This is not the time to interfere and take pills. This is the time to observe, and the next meal when you have at dinner should be just soup. It is just giving that direction. If you're going to go and have your tea now, don't have sugar. Don't have biscuits. So this is what the parameter is telling. So when his hypoxia was at 56, we had patients who had hypoxia from 75 to 90, which we had done with just Ayurveda medicines, and they were not put on any ventilators from home. Their sugar level was high. All the LFT and KFT, that is liver function test and kidney function test, during a fever, I record here, will show high parameters or abnormal parameters. Kindly look into the website as to whether there has been a research on what are the changes which occur in the body, in the liver or kidney during a malarial or a typhoid fever. Is there any research which has been done? No. No doctor knows what happens to your liver or your kidney during a fever. There is no research paper. We have made an observation and found that during fevers, may it be COVID or typhoid or malaria, we found that all their parameters, the liver and the kidney function parameters were high. It was not due to it was only due to the condition, and after 3 weeks, when you do the test, it falls back to normalcy. So if you are thinking that your creatinine is high and you're going to go into a dialysis, it's your fate and you have not understood your body mechanism. This point you will not find in any researches. Researches, even in the Western medicine, has not been, we question Ayurveda. Go and question an allopathy doctor what happens during COVID. Okay, nobody knows. This is how. Has any study been documented on hypoxia? You all listen to hypoxia, right? If it is lesser than 90, you get admitted. Then the doctors made it 88, 90. During all fevers, have you used your pulse oximeter after COVID? It is all sleeping, thankfully, right? Otherwise, you will be having a heart attack every day. After sleep, if you're going to take your blood parameter and check for your oxygen, it will show a point lesser. It will be at 97. If you're an old person, it can even show it till 90. You keep recording it every day when you don't have a cold. Not in this season, please. Go to summer when you don't have a cold, because don't get frantic. It will show when you are in sedentary, the oxygen level which is circulating with the blood will be low. Even the allopaths would accept that the oxygen, the blood which is circulating in the periphery, the oxygen which it carries is different, and the oxygen which is carried by the central arterial system, the oxygen capacity is different. So you cannot even decide with just the pulse oximeter. That was a flaw. This has not been recorded anywhere. We have to accept, humanity must know to accept flaws so that you improvise next time. There is no error that we have made an error. But if you fail to recognize that we have made a mistake, what information are you going to give to the next generation? So this is hypoxia. There is not a single research which has been recorded. It is only with respect to COVID. But then why did you put the parameter that people below 90 should be admitted? If you had a COVID, if you just show that COVID becomes negative after a test, you are done. No. So proper researches have not been even formulated in the Western medicine. Yeah, I finish it off. One more point. When you are getting admitted into a hospital, there will be 10 medicines which you are put into your IV, right? No problem. Don't worry about it. But has there been any research of interaction between these medicines? Can you be given an antibiotic and a paracetamol? Are you cutting down my voice so that it's not getting published? Because because my videos were removed many times. This is science. Let's be practical about it. There is no research that What happens when you're given a gelusil, an antibiotic, an antipyretic, and an, an omeprazole together? There is no research of how 5 medicines can be put in your IV. Then how are you being administered? The doctor tells, I've experienced, don't worry. It's the same way the Dr. Sudhir also told, don't worry. Mercurial medicines are given since long time from your own rishis. We've seen practically. Don't worry and take your mercurial medicines. You understand? It is our gurus and our rishis. Apta, Shishta, Vibhuda, that is the first term. They've seen through ages, they've seen through time. They never lie. There is no necessity for them to market or to get an. So you can be very happy about taking a mercurial medicine. Our researchers are working towards it, and in probably a century or so, we'll have fantastic researchers which will come from India. So I'll go quickly. So this was the patient with the oxygen support. He came to us 56. We had to repeatedly ask them, are you in your senses that you're coming to us at 56? Thankfully, the patient refused his treatment from allopathic hospital. He was discharged against medical advice and was given a warning that he may have to book his place in a cemetery in 3 days, but he lasted for 27 days. He's healthy and happy at Palavakam. So these were the observations. 44, 38, 37, 34, 22 were his respiratory rate. These were the treatment protocol. We treated them with heavy metals. Heavy metal is a myth. The word heavy, don't get worried about heavy. The word, okay, even allopathy uses heavy metals very, very safely, as in gold or in cisplantin, which is given for cancer, gold for rheumatoid arthritis. We all don't know. Metals are given like gelusil. Don't take metallic preparations for more than 21 or 45 days. That is common sense. No Vaidya shall prescribe for more than 45 days. We still, even 3 months back, we have an entry from US. People who are getting injured by taking Ayurveda heavy metals, heavy metallic medicines. Scientific researchers have started reporting these. It is because of either wrong usage, or you always have to take some patya or certain dietary protocols. Never pick up a prescription, Ayurveda or allopathy, as an OTC. So these were the different protocols. So just going to see the ferritin level, the second level, 936, it was on 21.5, 1, 2, 3. Okay, 936, it was on 21.5. See, it went to 1723, 17, and 792 on the day of discharge. So initially, even allopaths were looking at ferritin, D-dimer, IL-6, but at the end of 3 years, they all are practicing friends. They told that they are not going to look into parameters. If you're going to look at parameters when you're diseased, this patient should have been put on dialysis. So it was not required. Look at the CRP. We never worried about the numbers, but you should take care. Like if you are at 300, it shows, the sugar level shows, you cannot be still taking sugar with your tea, right, or rich foods. So the numbers just gives you an idea, but it cannot be the only parameter. So these are the strengths and limitations. I would just have a few minutes. So what is the road ahead? The government is putting its might. It's just that for 70 years we were all sleeping together. So it has made all its efforts. It has made research agreements with US, UK, Australia, and all the Western countries as a, we tell as a Pulayar Suri, right? As a beginning has been marked. So this is just a beginning. We have a much long road ahead. Ayush hospitals, they are being established in AIIMS. Integration is going to be the norm in few years, which means pure Ayurvedic practice, you will find that it would come into a decline. So we need both pure Ayurveda practitioners, pure allopathic practitioners, and integrated practitioners. And researchers should be turned into these directions. And researchers inclusive of Ayush doctors are coming up. GCTM, Global Center for Traditional Medicine, is at Jamnagar. So these are the, and Ayush University in Tamil Nadu, we've been waiting for 70 years. There's not a single university in Tamil Nadu. We are working towards it. And judiciary, legislative, executive, common man, and Ayush. I didn't want to make an error with common man, CAO. We have to correct the common man there. It was not wanted. So we have to tie the loose ends. And one thing we must remember, the situation of the Veda Patasalas and Ayush system is, we are traveling in the same boat. The livelihood of the children who come out of the Veda Patashalas or the Ayush practitioners is almost one and the same. The patronage which they receive and when they come out of these Veda Patashalas, when they look at the world which is in front of them, how are they going to make their livelihood? It's the same with both these important fulcrums in our life, and how are you going to contribute to this is very, very important. Focusing Vedic brains to take up visible social responsibilities and in Ayurveda is very, very important. It's one thing which always hurts me. I don't like to treat a person who has studied the Vedas in my clinic, because the Ved Pandits know everything. You know about the Atma and Manas. And what about the body? Why does he come into my clinic? So I always tell them they should also learn about the body, which is Ayurveda. In all Veda Patashalas, Ayurveda should be, we have to teach Ayurveda to the students, and I don't want a Veda Pandit coming into my clinic seeking prescription for, after all, a heart disease, after all, indigestion, after all, diabetes. Everything has been laid in Sanskrit and Tamil, and it is all that we have to include it. So all the four varnas practice this medicine, and it's high time that the four varnas sit together and take a decision for the society for their own wellness. Increasing family size, joint family, adoption of kids, and supporting orphanages and adopting orphanages. Why am I discussing this here? All our kids are going to take only Western education, and we have to increase the number of people who think on Vedic lines for our own welfare. So increasing the family size is very, very important, and teaching at least one kid what is Vedic science, may it be astronomy or especially medicine, which we have forgotten, is very, very important. Don't waste your time in old age homes or just home listening to just spiritual talks. Yogi Ramsuratkumar was a visionary who had very clearly, he had started this Veda Patasala, and probably it is why after 2007, 16 years of break, that he has been reborn here along with Indian medicine. Indian medicine, it is a responsibility of the society to push all your thoughts into this, because for one, I would want the society to be selfish, because when the next epidemic comes, the doors are always open. For your children and for the next generation, it is the Ayush which is going to support us. So be selfish and promote Ayush. And funds for Ayush is the crunch which we are facing. This is one more idea which I was thinking of. We are having nuclear families. We should have had 6 children in our home. Yeah, last point, right? 6 kids in our home. So now what we find is we have very, very wealthy, affluent families, right? After 20, after 30, after 40, the parents are all very happy because the children are settled and we are all wealthy. Why does this wealth accumulate? It's because we don't have that 4th or 5th or 6th kid. The excess fund kindly direct into Patshalas and for promoting Ayush researchers. It is our responsibility. I would like to finish this with an Ayush pledge. If you're all interested, please join with me. Put your hand in your hearts. I'm proud of, and tell with me, I'm proud of India's rich and varied medical heritage. I shall always put my breath and soul to nurture it. Jai Hind. Thank you so much. Yogi Ramsuratkumar. Any questions, please? Yeah. You just tell me, I'll repeat the question. Yeah, tell.
One point and one question. The first point is you are mentioning that not only the Brahmins are practicing medicine at those days, it is also well documented by even the Dutch, because the Hortus Malabaricus was written by E.T. Achyutan, who was in Yerava. He was not a Brahmin. So even the Dutch, because it was done at the behest of the Dutch governor of Malabar at that time. Second point, what I want to make is, you said that we should ask the government to have more Ayush centers. But it should be the other way around, because I come from a village, I live in a village. If somebody is sick, we are not going to go and seek out an Ayurveda doctor because there is nobody around in 50 kilometers radius. So the British, they changed our medical system and put more allopathic doctors. So it should come from the government, not from the other.
No, let me tell you, the government is ready to do now. What happened in 2020, I would like to share. The government had passed a rule that what you tell is right. The government should do, the mother should know that the 7th child is unwell and give them medicine. What has happened since 70 years is, we never had a mother. We were left into the hands of some other person. So the family and the others have taken over, and how are you going to come out? So you start crying more. You start crying with not, if you're going to cry alone, you will not get it. You'll have to cry a little more with all, you have to have the idea, right? You understand? For example, in Tamil Nadu, this is happening. In Tamil Nadu, I'm not speaking politics, but it's a fact. There is this Sanskrit-Tamil conflict. So, there is no Ayurveda patronage in the state. Okay, they tell that you are all learning Sanskrit. I am a Tamil. I pay tax to the government. I am studying in the college which has been started by the Tamil Nadu government. But I finish my practice and I come, I'm told that I've learned Sanskrit. Is it my error? This is how the whole of Ayurveda is. So these are issues. We have to make them understand. See, the governments will keep on changing. So the public should always have this knowledge and should be aware of that there are no differences, and we have to keep, floating this. The media and the public, it is in our hands.
Sure, but for the public who is living in a village, how are you going to inform him? Because for people who are private
we have Facebook, because see, this is my problem also. I was not given a COVID care center. I had to fight. I am telling that fight along with me. We are all fighting. The Ayush system is fighting. We have got 3.5%, right? 88,000 crores is given for allopathy. Please continue giving 88,000 crores. We have to spend more for the Ayush system. When I ask, I need 10 more people to ask. That's all. That's what I'm
please spread your message so that more people can join you, because that's the point.
Thank you so much. Yogi Ramsuratkumar.
Yogi Ramsuratkumar, Yogi Ramsuratkumar, Yogi Ramsuratkumar, Jai Guru Raya. Just before lunch, I met Dr. Meera. Someone just came up to me and asked me something about a pen drive. I thought it was a college student who had come to attend the conference. She looked so young and so full of life. I didn't know that she was such an eminent doctor. Now, after hearing her talk, I feel she's the best brand ambassador for the Ayush system. So full of life, so full of vitality. Very correctly, she said, before she began to talk, she said she has a spot to talk immediately after lunch. Even I was wondering how I was going to sit up straight. I had eaten not one but 2 helpings of everything. So my body language was a bit dull. Then she took the mic, she started talking. I sat up a little. She spoke about Yogi Ramsuratkumar and the impact he has had in her life. I sat up even more straight. She spoke about how Bhagwan's grace has helped her heal during a very difficult personal time. I sat up even straighter, and then she explained to all of us, including ignorant people like me, what is Ayush. And then from that time, I've been sitting up. My spine has never been so erect in a very long time. So our humble pranams to you, Dr. Meera. Thank you for making all of us aware that there is a need for support for Ayush. It's nothing but Bhagwan's grace that has brought us all here together and is making us wake up to these pertinent issues in our country. Our humble pranams to you. Thank you so much. And we hope that we will have many more opportunities to interact with you in the future. We now request our dear Ma Devaki to please honor Dr. Meera. Jai Bhagwan Yogi Ramsuratkumar. Yogi Ramsuratkumar, Yogi Ramsuratkumar, Yogi Ramsuratkumar, Jaya Guru Raya. We will now have a technical talk by Professor V. Ramanathan. We have introduced him in yesterday's session itself, but I would just like to mention one small, just 2 lines about him. He has played a very, very instrumental role in bringing this national conference on new perspectives on science and technology in ancient India to life. And he has been so friendly, so approachable, and has truly been a guiding light for all of us. Thank you so much, Professor. We now request you to please come on stage and deliver your technical talk. Jai Bhagavan Yogi Ramsuratkumar.
As the slides come up, I have a small prayer. Nidra Devi Namastubhyam Dhavatu Kripaya Duram Ichhami Vaktum Kimchit Makuru Atra Shasanam. So, those of you who didn't follow Sanskrit, I prayed to the Nidra Devi that she better runs away from here, for I have something to speak for the next few minutes. I don't want her to reside here anywhere in this premises. I want the slides to be on, that's why I'm filling it up with this. It's in this, sir. This person said that he has put it in the thing. No. This is which drive now? Okay, I know. I once again stand before you, placing my humble obeisances to Yogi Ramsuratkumar ji and Ma Devaki also, and thank from the bottom of my heart to the Ma Devaki Veda Patasala Trust to have taken it upon themselves this onus of bringing in experts and giving them a platform through this conference. So thank you very much. And what you have been hearing from morning is about the health system, be it Ayurveda or Siddha, from 4 different speakers. This day's session was planned as though it will be from medicinal system as well as chemistry. The other speaker, Dr. Dev Pujari, supposed to come from Delhi, for some reasons couldn't come. So I'm the only guy talking about chemistry. Now, the manifestation of chemistry in the ancient India, when I say chemistry, is all-encompassing chemistry, not just chemistry per se, as we understand it today. This is the basic building block for these medicinal systems as well. Because in the reductionist point of view, whether be it a herbal drug or a herbo-metallic drug, one has to rely upon this rasayana that makes them, that equips them, and that makes them cure the disease of their patients. So, in a way, this is, if the previous 4 talks were of the practical end, this will be the theoretical background to those medicinal system for which our Bharatiya Rasayana Shastra was well developed and had attained its pinnacle stage. a very brief introductory remark followed by some of the metallurgical highlights. Because you have been listening about medicine, I will not harp anything on the medicine aspect. But besides medicine, I will also talk about the non-medicinal aspect of the chemistry and the metals that were there in the country. Highlights from a few prominent chemistry texts if time permits, and then with concluding remarks. It so happens that we are so enslaved by the colonial mentality that if some brown person like me or anybody for that matter says time and again, even in an English language, will never impress us. But if some foreigner comes and wax eloquent even in a German accented English or a French accented English, we will lap it up. And even if we not understand, we will cheer it with a lot of claps because we have to appear to have understood it. And it's not just an immediate response, but it also gets manifested in various other scholastic domains as well. So with that as a beginning and a reality with which, whether we like it or not, that's a reality, I begin by quoting William Ramsay, who is Nobel laureate. And he has to say this: the country which is in advance of the rest of the world in chemistry will also be foremost in wealth and general prosperity. So just keep this in mind. And this is not an off-the-cuff statement made by William. Now, if you look at the correlation between the Nobel laureates and GDP of the country to which these Nobel laureates belonged, and especially I'm looking at chemistry Nobel laureates here, there seems to be a strong positive correlation. Mind you, I'm not saying causation. I'm saying still it's a correlation between the GDP and the number of chemistry Nobel Prize that a country has produced. So this kind of vouchsafes supports what William said in the previous slide which I quoted, that advanced knowledge in chemistry, material science directly has got some relation to the economic prosperity as well. Now I'll change gears slightly and draw your attention to this particular trend. A very phenomenal work done by an English economist, Angus Maddison, who was entrusted to look at the world GDP for the last 2000 years, from the beginning of the Common Era till the year 2000. And this paper was published in 2003. And it's a very interesting paper for reasons more than one, from various point of view, like historical point of view, method of research, and of course the data that it has to show. What it shows is the two curves which are colored red and orange. I mean, this is not my way of coloring them. I got it from the net, so there is no sleight of hand here in putting specific colors to specific countries. We see that for the whole of the first millennia and the most half of the second, India and China seems to lead the contribution to world GDP. And after that, what happens? There is a steady decline, although there is a small hump, and I would not get into the nitty-gritties of why that hump comes. But we can see there is a monotonous decrease roughly after the middle of the second millennia. Now, if we look at the previous quotation of what William had to say and correlation between GDP and Nobel Prize in chemistry, we can ask a reverse question, a reverse engineering question perhaps here, that what is it that was in India that attracted the people, because of which you had this decline in the economy? We had decline in the economy because we were attacked, either through invasions or through trade establishments, and that's because of which we see a drain in one direction, and then we see this decline. Now, what is it that made the attackers or invaders attract towards the country? Definitely not the tourism, because the concept of tourism is a recent phenomenon. And if we say seek of knowledge and wisdom, yes, there were, but hardly a few numbers, which you can count it in fingers. So it must have been the material prosperity of the country which attracted our neighbors for good or bad reasons. So what contributed to this material prosperity? Yesterday we saw all those progresses that our ancestors had made in maths and astronomy, which showed intellectual acumen. Yeah, that's on one side. Yes, we treated our society in good health for a long period of time. That's how. Now what do we do with these able men with sharp acumen? They produced wealth. Because wealth generation is not a sin. It's accumulation of accumulating it in a very illegal way is a sin. But generating wealth has always been one of our cornerstones in the civilizational aspect. So yes, we generated wealth through material means. Of course, that also gave rise to Lokayata or Charavaka, but those are again not in the mainstream. I'll not get into that. But the take-home message that I wish to drive in the introductory remark is that, yes, besides having sharp intellectual acumen, besides treating our populace in good health, besides all these things, we were good at processing materials, extracting metals, processing them, and perhaps exporting them in tons of quantity, which resulted in the real wealth generation. Of course, in land of Tamil Nadu, everybody is aware of this famous Silappadigaram. Allusion was also made by Professor Iyengar yesterday when he was referring to this Vara, concept of Vara when it was introduced. To me, this also is a good chance to see the difference in the materials that are being used, only from that point of view. But some people from literature would argue saying one is from the seashore, which is obviously rich in pearl, whereas other is not from the seashore, so pearl is absent there. But the knowledge that one is Muttu and other is Manikyam, that itself gives us a lot of understanding of the knowledge of different kind of materials and what are their properties, how they are used in different contexts. Be that as it may, the modern chemistry of a grammar student and I teach is very different from the chemistry that I talk from the ancient Indian perspective. Then let's make that very clear in the very beginning. Because this modern chemistry that we study and teach in the school or college is a modern branch of chemistry that has had its birth in the last 200 to 250 or maximum 300 years. Systematized in the second half of the 18th century by stalwarts from Europe like Antoine Lavoisier, Joseph Black, Cavendish, so on and so forth. That's the chemistry that we are all currently familiar with, that we study in the scholastic domain. Whereas in my talk also and in general, when we refer to Indian chemistry, it is not just this branch of specialized field of chemistry, it is all encompassing other fields involving materials, for instance, from pottery, brewery, dye, metalsmithy, glass making, so on and so forth. So with this, if we see the contribution that the Indian chemistry is said to have made is also varied. Sorry about that. In different domains, and some of which are illustrated, which is in front of you. We do have references of metals right from a very early age. If you look at the Krishna Yajurveda, the famous Hiranyam Chame, Ayaschame, Sisam Chame, Trapushchame, Shamam Chame, Loham Chame, we get to see at one instance an explicit mention of 6 different metals. Now this would only be possible because of 2 reasons. One, now before I go on to the reason, we are all familiar through our history in the school that the human civilization has gone through various stages and ages. Paleolithic age, Mesolithic age, Neolithic age, all the 3 comprising of Stone Age. Then you have from Stone Age to Metal Age, starting from Copper Age, then Bronze Age, then Iron Age. Right? Now whether we are in Silicon Age or Garbage, that's up to us to look at the perspective. This is the standard timeline of evolution of different civilizations. With respect to India, whether it is applicable or not is a question that we need to ask. Why? Because one evidence is this, where we have explicit mention of iron and copper at the same time. This is only possible if this composition is composed after the Iron Age. That is when copper would have already been discovered, then iron, then this verse could have been composed. or this linear time frame of stone, copper, bronze, iron is indeed not applicable to the Indian context. These are the only two possibilities after looking at this Chamakam verse from Krishna Yajurveda, is what we can conclude at. But my point here is that there is an explicit mention of metals in the Vedic context. Now, from chemistry background, you need to know that not all of them are present in their native state in nature. We have to invest energy by giving them electrons. Then these metals are present in the salt forms, except for gold. Gold can be present in its native state. We have to invest energy by giving them electrons, reduce them to their zero oxidation state, and that's how a metal can be used as a metal. Otherwise, if they are in the salt form, which we cannot make use of them in the form of metal. So there is, mentioning a metal and not confusing with its salt. Mind you, this is not a very trivial thing. When we see them in the Chamakam as one passage, it may appear statistically very insignificant. But for me, as a student of chemistry, it's quite vital that much of process has gone, especially in the case of, say, Aya. Aya, of course, linguists are in logahorns, whether it is generic metal or is it iron. But for me, it is a metal. Let us take it as a metal. Sisa is, in fact, lead. Lead can never be present in a zero oxidation state in the nature. Some energy has to be invested to get it to its zero oxidation state. So the very fact our Vedic rishis, mantra drushtas, have not described the process. Fortunately or unfortunately, they did not have this burden of writing the paper in the introduction, methodology, result and discussion and conclusion format. They were not restricted to that, fortunately or unfortunately, due to which we cannot know how they arrived at this particular statement. But what we have is this statement. There are again linguistic nuances which I would not like to get into due to want of time. When it comes to gold, of course, gold has been the darling metal of different civilizations across the globe. Egyptians, Mesopotamians, Babylonians, as well as Indians. And provenance of gold on the Earth's crust is very, very, very minimal. It's even less than 0.01% in the Earth's crust. But despite that, the attraction of our ancestors, not just from this country, but from various other geographies to gold, is indeed very fascinating. And as I said before, gold is perhaps one of the few metals that is found in its zero oxidation state. So all that you need to do is mechanically separate, not chemically process, mechanically separate, and then kind of process it to the shape and the form that you wish to utilize it for. So there are various instances of gold being explicitly mentioned in our Vedic corpus, and this is just a very small survey where all you can find it. I'll not bother you to read line by line and explain where all it comes. This is from the specifically of the Rigvedic corpus, that a few I have shown you here, where all there is gold and its paryaya. Paryaya means the meaning, the alternate words for gold that we get to see in the literature, in Rigveda. Similarly, not just Rigveda, but when you go on to the Samhita period also, this is from the Shatapatha Brahmana. So just to impress upon you that there is a copious mention of this metal in our literature. And of course, ornaments. Perhaps ours is the only country that even till date, the obsession to gold in the form of ornament is still existing. And this is one of the civilizational memories that we carry forward. I mean, there are also a lot of back of the envelope calculations being made that if we extract out all the gold that are lying dormant in a woman's treasury at home, it will match the country's GDP. So that is, in fact, it is good, but then government after government, whether it is Congress or BJP, whoever it is in the center, mind you, everybody's eye is in that gold. Temple gold as well as the house treasury gold. So we'll have to be very careful on that. Nobody is on our side except for our own civilization, for that matter. So we have descriptions of various ornaments. And I mean, there are texts which go into detail of describing the forms of this ornament. And I'll not get into detail. And in Tamil literature, I was thinking that we are giving it in Chennai, so there must be also some allusions to Tamil literature as well. So this Ainguru Nuru, Vali Adan, Vali Avini. By the way, Adan is kind of cognate with Adam. So this also gives a lot of leeway to missionaries to interpret it in a different way. So Vali Adan, Vali Avini, Nelpala Poriga, Pon, Peridu, Sirakka. So Pon, of course, Ponniyin Selvan is what we call this very famously immortalized to the movie as well. So the word Pon, we have a lot of provenance for it to occur, but not just Pon, and there is also another example from Purananur, Igai. Igai is also another synonym for gold. It was a news to me when I was making it. Then Seidai, again Pon, you have another example. And interestingly, the other words for gold in Tamil itself are like Atakam. Sembon, of course, we have seen it. Kilichirai, Navalam, and there is one more word, Sambunadam. Okay, I want you to just keep this in mind, these particular words, Atakam, Kilichirai, Navalam, and Sambunadam. Because here, now I put it in Devanagari, so perspectives will slightly change. From Dravidian, I become Aryan now. So, Jambunadam, Shatakumbham, Hatakam, Vainavam, Shringashuptijam, Jatarupam, Rasavidham, Akarodgatam cha Suvarnam. So they are all the different varieties of gold is being described here. Now if you have not yet slept, a question to you, can you guess which text I am talking about? There you are, but cheating that is. Because we were discussing about it yesterday. This is from Arthashastra. The reason to ask is, the general perception among the people about the document Arthashastra is that it is a literature on polity, or it is a literature for economics. But mind you, it has got a whole Adhikarana. Adhikarana is like a mega chapter on metallurgy and material science. That is the second Adhikarana. And it starts with gold, silver, copper, all the 6 metals. And then it goes on about gems. It goes on about different minerals, salts, and dwells much deeper. Why am I harping about this is, all said and done, this is one of the earliest written text evidence that has come down to us in an unbroken way. Because again, caught in the Western trap, we need to go for written evidences. The Sur Parampara or the Maukhik Parampara is not given that much provenance to. It is classified as intangible world heritage. That's all you do. It's like putting something on a pedestal and worshipping it, but then not making use of it. Making use of it really comes when it is form of a tangible evidence that become intangible. Keep that in mind, okay? I mean, Vedas have become intangible heritage for that matter. So this, now you see the similarity between the Tamil synonyms for gold, Atakam, Kilichirai, again, Kilichirai doesn't come here. Shringa Shuktijaya only it comes, but it comes slightly later. The Kilichirai was indeed a very interesting revelation to me as well. But other names like you see Navalam, Jambunadam is exactly what you find even in the Sanskrit literature. Now, we can create controversy by saying whether Kautilya copied Tamil literature or Tamil literature copied Kautilya. That is like a chicken and an egg problem. It is not going to solve the purpose. The point that we need to recognize or kind of reconcile is we have the provenance of these equally in Sanskrit and Tamil. That's a message that I want to convey here. But that again, okay, here what is being told, the second sentence here is Kimjalka Varnam Mridusnigdham Anadi Bhrajishtu cha Sreshtham Rakta Pitakam Madhyamam Raktam Avaram. This is a style of writing the text also in the ancient this Shastra period, that you give very cryptic lines about their properties as well. So here the properties are being discussed. And the next one, if you see here, Tataha Shulka Kakunyat Uttarapasarita Chatusiman Taditi Shodasha Varnakaha. It's talking about alloying gold with copper. Shulba Kakuni. Kakunya is a measure. Shulba is a copper here. Interestingly, by the way, Shulva is for copper. All of you must have heard the word sulfur, right? Sulfur, actually, word comes from Shulvari of Sanskrit. Shulvasya arihi iti Shulvari. Why Shulvasya ari? Why is it called enemy of copper? Because sulfur readily reacts with copper among the different other metals. Since sulfur readily reacts with copper, it is deemed as copper's enemy. So this has become Shulvari in Sanskrit. And that get etymologically transported to English as sulfur, which we today also use it in the textbook. But as a student of chemistry, I never came to know, even till my PhD, that the etymology of sulfur is Shulvari, thanks to our education policy. Here what I wish to say is, the gold is being alloyed and there are 16 varieties of gold is being talked about. Today in the market we know there are 24 karat, 22 karat, 20, 18, and in India nobody goes below 16. But in Europe, Raghav, you can verify it with Raghav, they will start only with 18. If they go to 20 also, it will be like very difficult for them. And their 18 karat will be more expensive than our 24 karat today. Because the labor charge there will be very different over there. But here, Kautilya's time, we talk about 16 varieties of gold, and they are made by alloying it with copper. But mind you, I am not at all to give an impression that Kautilya's time people knew phase diagram. For those of you from metallurgy background or physics background, phase diagram is what I am showing you here, where on the x-axis you have the material composition and on y-axis you have temperature. That is, if you want to mix 85% of copper, gold and 15% of copper, what is the temperature you need to heat it up so that they become an immiscible liquid, alloy. Otherwise, they may become immiscible at a higher temperature. When you cool down, they will separate out. You do not want that. Like this, today we know, we understand it from this concept called phase diagram. I am not at all hinting that our ancestors knew phase diagram, not at all. They had done it, in what way they did it, they have not revealed it to us. It could have been empirical, it could have been serendipitous, it could have been even methodical. We don't know. But all that we know from what they have told us, they have made 16 varieties of gold. Okay? And not just that. Suppose somebody has made, say, 16 karat gold and selling it at the rate of 22 karat gold. He should be punished. Now, for that, one needs to identify that this is a 16 karat gold. And that is a technology which even today we are using in a continuous way for 2000 years. And what is that technology? It is that Uraikal. This Uraikal technology has been documented in Arthashastra. That is what is the bottom shloka is what is revealing about it. And when a certain particular thing documents it, it doesn't mean it was invented during that time. A Priestley discovered oxygen in the 16th century. That doesn't mean oxygen came into existence only in the 16th century. So similarly, we do not know when was Uraikal in practice or from when it was in practice. We do not know that. But the first written evidence, we get it from the period of Arthashastra. This is again a description of a solid state reaction. Akarot kritam sisanvayena bhidyamanam pakapatrani kritva gandikasu kuttayet kadali vajra kanda kalke va nishechayet. So this is a description of a solid state reaction which is non-trivial even to this day in any sophisticated chemistry lab. Because just a basic chemistry, when we eat, madhye paniyam samarpayami is what we also do. We also take. So that there is the fluidity is maintained, and in the stomach when it churns, it is easily digestible if it is in a fluid form. So chemistry happens when things are in a fluid form. So solid state reactions are extremely difficult, even from modern chemistry perspective as well. So here is one such example where we get to purify gold from its ore by mixing certain salts and beating it. And that is what is being talked about here. This English description is here, I will not get into the detail. So much to tell you that I have covered gold only till the Arthashastra period. That is from the Vedic period till Arthashastra is again not dated. Perhaps ours is the only country which can go to Guinness Book of World Record to have maximum number of scientific texts and scientists who are undated. So, for instance, Kautilya's Arthashastra itself, we do not know when it was written. And there are people who claim that there is not one Kautilya, there is not one layer of Arthashastra, it has grown over a period of time. That's a very pet peeve of our people who would like to beat us. Be that as it may. But still nobody has at least put it as absurd as 500 AD or 250 AD. No, it is before the Common Era, that much we know. How much before the Common Era, that we have not, we have also been lazy, we have not worked it out yet. We are waiting for some Oxford or Cambridge to do it, and then we will, time and again, I'll come to the stage and repeat it with all pomp and show that, okay, this is the Oxford result. Moving ahead, iron has also been one of our very important civilizational metals. I actually forgot to put a picture here. Gold, of course, was respected, but if you go to Jamshedpur, if you have a chance to visit to that Ranchi, not Jamshedpur, sorry, in Jharkhand, capital of Jharkhand, Ranchi, there is this Steel Authority of India Limited head office over there. They have a very big plank, like how you have this Arjuna, Krishna, that Bhagavad Gita episode thing, as big a plank over there, depicting Alexander and Puru, the interaction between them, and Puru is standing with an attendant who is having a gold case, and inside that there is a brick of iron. You see here, today we put our gold inside the iron safe. There, gold was the safe, and iron was kept inside and was being gifted to Alexander. Okay? The point is, steel was considered, when it was discovered, steel was considered, and especially Indian steel, was considered even much more superior to gold. Of course, they didn't make ornaments out of steel and wore it. They were not that foolish. Ornament status was given still to gold. But when it comes to erecting building, or when it comes to making utensils, they did not waste gold for that. They were judicious in selecting what is it for what. Now, how did they come to it, that we do not know. But iron was prized to that extent, because by that time, perhaps the requirement in the war, in the military, in the form of weaponry, iron was much more in demand. There are, in agricultural equipments also, if you look at the research, there are very few copper sickles being found, and when iron took over, the copper sickles are completely replaced, because the copper is much more ductile than iron. The robustness of iron can be felt. The Vedic context, again, among the linguists, you have a lot of splitting the hair and also cutting each other's throat, of arriving at the consensus on the meaning of a particular word. So here, such word is Aya. There are people who argue that Aya became iron, so that in South India, even now, if I say iron, I'll be looked down upon. It has to be pronounced only iron. In North India, if I say iron, I'll be looked down upon. I have to say only iron. So now, being a student of chemistry, iron, I-O-N and I-R-O-N has to be very differentiated. So student of chemistry, I say it as I-R-O-N, iron, and I-O-N is iron for me. There are linguists who argue, okay, iron has come from iron. Okay, be that as it may, that's a different story. Let's take it as Aya as a metal, not even like an iron metal. What it says is, it talks about the war in Rig Veda, where one of the character in the war, named Vishpala. Linguists are again in loggerheads, whether this Vishpala was a female warrior, or he was a man, or it was a horse. We don't know yet. Whatever the character Vishpala was, she or he or it had lost the leg. Now here, Sadhyo Jangham Ayasi Vishpalayai Dhane Hite Sartave Pratyathattam. So this Ashwin, there is a reference to Ashwin somewhere in the previous one it comes. I think it doesn't come in this shloka. The previous shloka it comes, that the Ashwins had given a prosthetic leg to this Vishpala. Prosthetic leg, some people interpret it as iron leg, some people interpret it as a metal leg. So what I want to hint upon is that there is an invocation of metal even in this context as well. But what fascinates me is that when you look at the archaeological artifacts across the country, right from Delhi till Tirunelveli, or from Dwaraka till the east, far east, you see that the composition of the finished iron artifacts, archaeologically excavated, are more or less similar. What could it mean? That the pan-Indic knowledge of processing iron was prevalent. Or it could have been made in one central location and it was distributed. The second possibility is of a very theoretical possibility. Practically, it would not have been possible. So there is a diverse prevalence of a pan-Indic knowledge of processing iron, and that too processing it in such a way that it remains rust-free. All of us know about the Delhi iron pillar, which has remained rust-free, but there are several other iron pillars besides Delhi iron pillar. Close to this place in Karnataka, you have Kolur Mukambika temple, where you have this Kodachadri iron pillar. Of course, now people are again starting to report that it is starting to rust. Perhaps they were waiting for centuries when it will rust, when it will rust. Now since it has started rusting, they are taking interest on it now. Otherwise it was Delhi iron pillar only. Then there is, you have in Madhya Pradesh, you have Dhar. In fact, Dhar iron pillar is, if I am not wrong, more than 2 times the length of the Delhi iron pillar. Now it is cut in 3 pieces and kept horizontally. Then if you go to Puri in Odisha, you have the iron beams used for the doorway kept outside, lying exposed to the nature, sun and rain, but still not rusted. So they have prevalence, we have prevalence of this rust-free iron throughout the country. I spoke about it. Then you also know about the famous, what is this sword called? It's called Damascus sword. Damascus is a place in Syria, but then it comes from woods steel. Woods is again an anglicized word. Basic word is Tamil. Urukku. Urukku becomes ukku in Kannada and Telugu, and then these people anglicize it to woods. So that's how it is referred to today as even woods steel and as a Damascus sword. The beauty of it was that it could last several killings. That it didn't, it was quite lightweight and it lasted several beheadings without losing its sharpness. Of course, today you will not behead with this. I mean, today even words are enough to behead somebody, or you use nuclear bombs. But the point is, the technology that will go into making lightweight iron yet retain its physical property is quite an interesting and important property. I'll not get into the ideological aspect because that will unnecessarily digress me. And yep. Just last comment on the iron technology is that I should now in this context remember Professor R. Balasubramaniam. Thanks to him, I got into this foray of archaeometallurgy and interest in such topics. Unfortunately, he passed away very young. He was a professor at IIT Kanpur when I was a student, and it was he who had introduced these kind of topics when we were students, and it was he who had found out the science behind the Delhi iron pillar, why it did not rust. Now in his work, when we were listening to him, it was made very clear to us that the maximum quantum of the railway budget that goes into is maintaining the railway lines which are rusting very frequently. So it is still a mystery as to why we can't go back to the older technology of making rust-free iron so that a major chunk of our railway budget can get easily solved. Okay, so technology was there, and there are people to resurrect it. Now, commerce and economics has to also support for that. In this age of global tendering and where things become a global market, even though we have a proven technology, to get into the market for is also a challenging aspect. Anyway, going ahead, I will wind up soon because I would also like to attract questions if there are. Copper, as those of you who have had some experience of wearing some copper like a kada or a kangan, you will see that it will become green very soon because it oxidizes quite fast. But here you have a very tall colossus standing Buddha excavated from Sultanganj in Bihar around 1850s or so. I think it was Alexander Cunningham who had started the excavation. But right now it is remaining safe in the Museum of Birmingham. And thanks to that, it has not perhaps rusted, or thanks to the copper technology done by our ancestors, that it has still not rusted. But it is no longer with us, it is with Birmingham. Okay? So not just Kohinoor, not just our skills, we have to get back a lot of things. So in the context of copper, with the two alloys of copper that are very important are brass and bronze. And with one professor in Chennai, a book chapter is coming out, maybe which should be out by early next year, where I had the good fortune of writing it along with Professor Desi Raju of IISc. We have gone much deeper into the provenance of the brass in our country. Just very quickly to tell you, brass, pittalai, what we call it in Tamil, can be made of two types. It's an alloy of copper and zinc. Morning talk, Sudhir told that Nagam is a word referring to zinc. But today, what is the popular reference to zinc. How do we refer to zinc in Tamil? Sorry? Tuttanagam. That's what. That is the word that I was looking for. Zinc is referred to as Tuttanagam. And interestingly, the Chinese word for zinc is also Tutanag. Exactly borrowed from this Tuttanagam of Tamil. Okay? And it is established that it is borrowed from Tamil. So Tamil did not borrow it from Chinese. So linguistically it has been established. So I can confidently say that. In the Sanskrit etymology, zinc has got various names at different periods. So I'll not get into the finer aspects of the linguistic nuances here. But brass can be made by alloying copper and zinc. Now, there are natural processes. We showed that zinc always occurs as an ore along with lead. Lead and zinc ore come together. In fact, not just lead and zinc. Many minerals, many metals ore come together. Because of their similarity in the atomic size, many ores will come naturally together. And together is also copper and zinc also. And if you are smelting copper, at that time if you get brass, it's called an accidental brass. But in such brass, you cannot have more than 15% of zinc. But there are several archaeological artifacts where you have more than 30% of zinc. You travel slightly north of Bangalore, in Bidar, you have Bidri works, quite famous. Bidri works contain zinc more than 40%, sometimes even close to 60% of zinc. So such things are only possible if you have pure zinc alloyed with pure copper. It cannot be an accidental brass. And brass has got various synonyms like Riti, Ritika, Pittala, Arakuta, Ara, Swarnaka Krita. If you really look at brass being made, if you go to Swami Malai, of course bronze is what you will get to see. Brass, there are very little pockets in Tamil Nadu, but if you come to north, there is a whole belt of smelting brass. If you see the smelting process of brass, you will get confused for the time being whether gold is being melted or whether brass is being made here. So it has got that kind of a shine, and our ancestors had beautifully captured it by the term Swarnaka Krita. For that. Anyway, I will not bother you with these details. The mention of brass in ancient literature are far and wide. One such example is from the Atharva Veda. Tadaha Vaishwanaram Pittalam Tadashvina Viveshata Viveshatamiti. Again, Pittala comes in Katya and Shauta Sutra. See, there were mention about Shauta Sutra, Shauta Yaga and all yesterday. That, for me, what interested is, what are the utensils that go inside those Shauta Yaga? Because you have to make a lot of rice cakes for that. You have to keep it above it. Some rice cakes have to be done in a flat pan, something in a hemispherical. What are the utensils they were used? There was specific mention of earthen pot, earthen utensils. There is specific mention of iron and copper and brass. So those distinctions to have been made, it's also quite non-trivial task. I will not bother you with this again. Bronze, of course, I don't have to talk to a Tamil audience about the bronze technology. Zinc, I'll close with the zinc part. Zinc, I'm glad that Dr. Meera is still here. She was about to leave, but something brought her back. There is a reference to Pushpanjana, even way back in Charaka Samhita. Normally considered as calamine. But does that really mean we are using zinc? That's again a bigger question mark. And similarly in Arthashastra, you have Akarodgata, even used for silver. I have not shown you the shloka for silver. But interestingly, zinc also comes as a zinc ore, are often found occurring together with silver ores also. That's why one of the names of zinc in Sanskrit is Yashada. Yajayor Abheda, Yashada becomes Jashada. Jashada in vernacular parlance, it becomes Jasta. And that's what today in North India you use Jasta for zinc. Okay. The point here is zinc provenance, when it was exactly found in the olden literature, is still unclear. And my search and any amount of discussion with Ayurvedic people have not come to any converging consensus on that. That's an open question still left for academic research. But what we surely know is from at least the 12th century in the Common Era, where texts like Rasaratna Samuchaya clearly talks about distillating zinc. So this is one such process which describes about how you use a Vrintaka Musha, and Vrintaka Musha is like a brinjal shaped retort. You keep the one at the bottom underground facing up, one filled with calamine and some carbon material for it to carbonize it, and invert it, place it on the top. You apply heat from the top, the zinc melts, and one of the properties of zinc is that as soon as it melts, it has a tendency to vaporize. So you cannot process it in an open furnace. You have to have a closed furnace. And this was one of the ingenious, perhaps world's first closed furnace thing that people were able to lay their hands upon and thereby process zinc. Chemistry is quite involved here. I'll not get into those aspects. But what is more important is again a stamp by a foreigner. Like in this case, a Cradock, whom even we had given a Padma Shri, if I'm not wrong. Cradock is again a UK museum curator as well as a metallurgist, archaeometallurgist to be very precise. He had an extensive work on Indian archaeometallurgy, no doubt about that. B.M. Hegde and our B.V. Subbarayappa from Karnataka, they have all worked with him as well. Rather, he has worked with him as well. What he has to say that many tens of thousands of tons of zinc were processed, and this, they claim, is the earliest dated zinc mines in the world. Earliest known zinc production on an industrial scale. Again, there's a question, why was zinc needed that much in 12th century, 13th century, is again an open-ended question. Today we use zinc for galvanizing. Suppose you have an iron bar, and then you galvanize it with zinc so that the rusting process, you call sacrificial protection, because the zinc acts like an anode, and the corrosion process, zinc corrodes faster than the iron. It's like how some females apply cosmetic on their face. The UV first reacts with the cosmetic and not your skin. So same way it is like the galvanization. But back there in 1200, 1300 CE, what was the use of this much amount of zinc in the world is something that is people have not yet looked at. But the fact is, yes, India was producing zinc and it was exporting. And it's not that the tradition is lost. Those of you who are here can just go to Swami Malai and see how the bronze business is still thriving. This is a place from not very far from here, Aranmula near Trivandrum, where the tin bronze-based mirror are still used. And from Rajasthan, the Theva art to make very tiny filigree of gold on glass. Same filigree work from Odisha you have on silver. And the place where I'm currently coming from, Banaras, it's known. All the Kanchipuram Pattu Podavai that we all see here, the jari actually comes from Banaras. The basic jari comes from Bombay and Surat, and they make the brocade, and those come back to Kanchipuram for that Korve Pattu that is weaved as a cross to the Tanabana of the fabric. I will not bother you much here. Perhaps my last slide, and I will close with it. Again, if you have battled your sleep till now and you are still awake, what I want you to make out is, what is it that the Granthakara is trying to convey here? And not Raghav, not Sudarshan, others. Not Meera also. All that I want is, what is it that they are trying to convey here? Don't tell me the literal meaning for it. Avartamane kanake pita, tare sita prabha, shulve neela nibha, krishnavarna sureshwari, vangejwala kapotabha, nage maline dhumaka, so on and so forth. Shailetu dhusara devi, so on and so forth. Don't worry about literal meaning. Any guess? Unfortunately, I don't have any school student here, but I'm sure you all would have your kids or grandkids in school. Perfect, bingo, you are there. This is the first ever documented flame test of metals. But unfortunately, of course, our textbooks never inform us about this kind of intellectual heritage. Avartamane, you introduce Kanake, gold, to the flame color changes to Pita, yellow. Avartamane, Kanake, Pita, Tare is silver, Sita is white, the Prabha, that flame becomes white. So on and so forth it goes. There are internal things. They had even arranged the metals in terms of the reactivity. Suvarnam, Rajatam, Tamram, Tikshtam, Vangam, Bhujangamam, Lohantu, Shadvidam, Tacha, Yathapurvam, Tad Akshayam. See, I have deep respect for all the spiritual tradition, no doubt about that. But nobody can sit in meditation and somebody can come and say, you arrange the metals in this order. And that's how the sloka would have come. No, this is not possible based on that. Unless you do some empirical test. Because why I'm saying this is people always, the critics always say, fine, everything is only fictitious in your literature. People have not tested it. We do not have the methodology aspect described to us, unfortunately. They felt that we are good, brainy enough to crack that out. It's like saying, ungaatla innikku enna samayal naka, na innikku saadam adichenu yaare solvala. புரிஞ்சுக்கணும். சாம்பார் இருக்கு, தளிகம் இருக்குனாக்கா கண்டிப்பா சாதம் இருக்குங்கிறத புரிஞ்சுக்கணும். 100 வருஷத்துக்கு அப்புறம் சாதமே இல்லாத போது சாதமே எழுதலையா, நீ சாதம் போட்டான்னு எப்படி தெரியும் உங்களுக்குன்னு கேட்டா அது எவ்வளவு ஒரு அசத்தனமா இருக்கும் அது. That is similarly, the methods have not been entailed in our text for various reasons. That doesn't mean they did not do the test. This is only possible after they have done the test and they have documented it. Yep. This is like, since we are all involved, both MDS, Ramanna, Rama Jayasundar, Madam, now we are involved in some textbook writing also. So, as from chemistry point of view, I think those of students who could not get maths group, first of all, those who in India, the point is, those who could not get into science, engineering, they will come to science. Those who could not get maths, they will go to physics. Those who did not get maths and physics, they will come to chemistry. So much so that the chemistry is made in such a way that is either getting all the filtered out products, and either those products are writing the books, because of which the books are so dry and boring. I don't blame, you take up a book of chemistry, you feel like, you understand why students hate chemistry. Whereas you take up a book of physics, like Richard Feynman's lectures in physics, the kind of interesting thing he makes in physics is very different. Here, I get inspiration from the ancient Granthakara. All that the Granthakara wanted to convey is, sulfur is very reactive. That's all. How did he convey it? Here you see a picture, elephant subduing a lion. Although we know, lion is the king of a forest. But when does a lion become a king of a forest? Only by killing an elephant. And when can it kill an elephant? Only if the lion attacks the elephant from the back side. If the lion attacks the elephant from the front side, lion will always lose. Elephant will always win. Right? So see the Granthakara, who is a chemist, who captures this and puts it in the thing to convey sulfur is reactive. Naso asti loha matango yenna gandhaka kesari nihantvad gandhamatrena yadva makshika kesari. There exists no elephantine metal that cannot be subdued by a lion like sulfur. மூக்கை இப்படி தொடறதுக்கு இப்படி தொடறான்னு கூட சொல்லலாம். ஆனா இதுல ஒரு creativity இருக்கு இல்லையா? You see, now student is made to learn about the ecology also. What the cross-disciplinary thing the NEP is talking about. Sulfur is reactive, okay, I know, but now through this imagery, if it is being introduced, it can only add to the knowledge to the student. Okay? So, yes, I have told so many things as last slide. This is truly my last slide. I will not go beyond that. Because a student of Raman spectroscopy, I always like to end my talk with his slide. Raman was given Nobel Prize. He was invited to Cambridge by none other than Rutherford. Raman tours around Rutherford, Cambridge, and comes back to Rutherford and very dishearteningly says, Cambridge is not a place for serious science. Can you imagine? Raman touring around Cambridge and coming back to Rutherford and saying Cambridge is not a place for serious science. Why? Because in his entourage, Raman sees people dancing, people singing, people doing carpentry, people doing metal smithy, all sorts of things people are doing in Cambridge. That's how he gets an impression that this place is not for a serious science. And what does Rutherford reply? We do not grow bookworms here. We train men to govern empire. And somehow in yesterday's talk, what MDS has said, this 200 years of slumber has only made us bookworms. So that at least I cannot do a metal smithy, but I can talk about metal smithy. So I'm also an example of that bookworm here. We have only ended up making bookworms. So at least now through such intervention, through such conferences, we we'll aspire to make people who can govern empire. And I once again thank you all for your patient listening, and Ma Devaki Veda Patasala Trust to have given me this wonderful opportunity to share these thoughts with you all. Thank you. I know I have overshot time, but we can break for tea. If you have any questions, any burning question, you can have one. Otherwise, we can take it up during the tea break. Okay. Thank you very much. Okay. I mean, I'm given the privilege of at least answering 2 questions. So for formality's sake, you can ask 2 questions at least. Yeah, thank you, Raghava.
So when I was doing my internship in the Raman Institute, his ashes are scattered on the tree there. We used to play football there.
So there's a tree which grows, which he has,
Yes.
when his ashes were interred,
Yes.
they had planted a sapling. Now the tree has actually grown there in his thing. Raman is a very interesting phenomenon, I would say. Talking of Pittala, perhaps I should have mentioned it there, but now that you talk about this, he was very upset with Nehru for somehow or the other reason. Once Nehru was supposed to visit RRI, okay, and then because he was upset with Nehru for various reasons, because of starting CSIR, because of starting this planning commission and all. But when he invited Nehru to RRI, there was a demonstration where something was appearing like a gold, glittering like a gold, and Nehru was taken aback. Then in that curiosity, Nehru asks Raman, where is this gold from? Then Raman says, aha, I cracked you. This is not gold, this is actually bronze. And when the UV rays are shining on the bronze, it glitters like gold. So I made a fool of you. He takes that kind of a pride and he also writes about it. So he had such kind of quibs with him. I mean, there are a lot of things that we can talk about Raman on a personal basis.
Yeah. Can I ask a question, sir? So you discussed about all the metals. In Ayurveda, we find, and in Siddha, we use mercury, but we don't find that it's explained as a metal anywhere, as a loham, because probably it's not very hard. And we use it in Kalvam and we make it into a powder form like a kajali. So how has the other Shastras explained about mercury?
Mercury, there is again a controversy in Charaka Samhita, if I'm not wrong. Rasaka, there's a mention of Rasaka which comes not in very frequent places, very few places, where some of the Rasashastri have interpreted that as mercury. Of course, I am not supporting that. But yes, it's true that our early literature do not talk about mercury at all. So much so that even in Arthashastra, people have tried to interpolate and match to some terms like, again, rasa, rasaka as mercury, but there are no strong evidences for that. There is one text which is quite enigmatic, and there's a reason why I'm saying enigmatic is, this is Rasarnava. Can you imagine the dating of this Rasarnava? What is the error bar that this has? You have it all the way from 1500 BCE till 800 CE. 2300 years of, I mean, plus or minus roughly it is 1300 years error bar it has. Now, why I'm saying this is, Rasarnava is the first one text where we come across a lot of description of mercury. Okay? Now, the term rasa somehow is equated to only mercury, which is in fact wrong. And starting from P.C. Ray, they have classified all such texts which have got the term rasa in their title as an iatrochemical and a tantra period text, which they have dated it from 8th century CE onwards. But there is one guy, Bhudev Mukherjee, who writes in the book Rasa Jala Nidhi. He puts the date to Rasarnava as 1500 BCE. Now, if you look at various other texts which have come later, which talks about mercury, they take a lot of allegiance and reference to this Rasarnava. So definitely Rasarnava seems to be early text. Its date we do not know, but that's the first text where we get to see explicitly about mercury. Tamil text, yes, there are a lot of Siddha, Sudhir is not around, but he'll be able to supplement it better. There are references to Mercury coming, but then the dates are again debatable in the case of Siddha text. I know that people from JNU have worked in it, where they have said that a lot of things have been extra exaggerated in terms of dating, but let's not get into that. But to me, it appears Rasarnava as a first text which describes about Mercury. Mercury is not found in our soil. Like many other metals, mercury is not found. So the theory of how it came to India also is a bigger question there.
It is found in Himalayas, right? The wells of Himalayas?
Like anything one thing is that anything and everything we attribute it to either Vedas, if it is in the intellectual domain, or Himalayas, if it is in the material domain.
No, there are wells from which they mine, right?
I get your point, but on a lighter vein, I said that if you read Subbarayappa's works, he is of the opinion that it has come from China. There are other chemists who have shown references to mercury in South America, but how it traveled from South America to India, that link is not still clear. But again, how the mercury came to India is an open question. We really do not know. But yes, of course, after it had come, we had made very well use of it. That is, of course, known to everybody. But yeah, to answer your question in short, it is Rasarnava, and how it came to India, we don't know. Okay. Yep.
Is it possible that iron in the copper age could have been from some sort of meteoritic source, not necessarily an ore?
See, regarding gold, there is a lot of such theories that it is not naturally found because Earth is not conducive for producing, Earth's crust is not conducive for producing gold vis-a-vis other metals, and that's what the statistical distribution also says. So regarding gold, yes, I have read a lot of papers where it is said that it is either a meteoritic showers which had got impregnated in rock. But regarding copper, I am not very sure. I have not come across such meteoritic provenance of copper. Regarding gold, yes, I agree.
Because in Egypt, there is apparently a metal sword during their Bronze Age, which was forged from meteoritic ore or something.
Yeah, whether it was a meteoritic thing or whether it was really an ore, we do not know. But yes, Egyptians, as I told in my talk also, Egyptians, Babylonians, Sumerians were also equally adept in processing gold. They were also having that kind of knowledge. Very well. I was afraid that this question would not come up. Alchemy, again a very like algorithm, al-Khwarizmi, it's algorithm, alchemy becomes alchemy. My readings in that are not mature yet. Let me put it that up front. But in my process of reading, what I have come across is that, and it will be back supported by Meera as well as Sudhir, I am sure, you have two concepts of Siddhi in our tradition. One is called Lauha Siddhi and the other one is called Deha Siddhi. Okay? And Sudhir in his presentation had talked about when was mercury first used in the body. Correct me if I am wrong. But in the Ayurvedic literature, I think it was in the Ashtanga Hridaya that for the very first time we see this is in the context of mineral acid, so I don't have to take that reference. Coming to the Deha Siddhi and Lauha Siddhi, there seems to be a methodological approach. Because in Dhatu Shastra text, suppose an alloy is made. Why do we make an alloy? To strengthen its mechanical property and make it more robust to rusting. And how they describe it, the Dhatu is attaining Amaratva. So that Amaratva, the immortalization of the Dhatu is what is being invoked for that particular metal when it is getting alloyed. So through such Lauha Siddhi, they attempted to have this Deha Siddhi. It is like first experimenting in guinea pig and then testing it in human. That's what animal testing is what is done today. Our ancestors, Vaidyas, they did it first in the metals and they checked it out. How it reacts in the metal. If they're convinced, then they converted it into the medicine for the human form. Okay. Now, this concept of alchemy was differently pursued in Persia and in Europe, where they were behind converting everything into an immortal, we are today attributed as gold. But this concept of immortalization is what is I'm trying to draw an attention to this long winding background there. So perhaps with that baggage, when they looked into these literature also, they have wrongly attributed this practice to what they were practicing as alchemy is what my ongoing studies, but as I said, my study in that is still immature. I have to make some more refinements on this concept. I hope I kind of gave, because as a teacher I'm told if I can't convince, I should confuse. So that's the trademark of a teacher. So that's what. Thank you very much.
Yogi Ramsuratkumar, Yogi Ramsuratkumar, Yogi Ramsuratkumar Jaya Guru Raya. Thank you so much, Professor Ramanathan, for a very, very interesting talk. I do have a question for you as well. So what is the correct pronunciation? Is it iron or iron? Okay, I think that will be an ongoing question. Thank you so much, Professor. And I think it was a very scintillating afternoon session. Once again, a big, big thank you to Dr. Meera and Professor Ramanathan for really engaging all of us and keeping things so interesting. Before we honor Professor Ramanathan, I'd just like to say 2 lines, and that is, I think we all agree that we're living in a time where there is a revival of our ancient wisdom. And hearing people like Dr. Meera and Professor Ramanathan, I'm convinced that our country is in the right hands. They are the torch bearers of this revival. Dr. Meera spoke about coincidences. I don't think it's any coincidence that Bhagwan Yogi Ramsuratkumar has brought all these torch bearers on this stage, and us, the lucky audience, we get to sit, we get to hear this pearls of wisdom. We have been fed so well. It's been a treat for all our senses. So a big, big thank you to Bhagwan Yogi Ramsuratkumar. A thank you to Ma Devaki and all the organizers for you making this event such a grand treat. On that happy note, day 2 of our national conference has come to an end. But please don't think the program for today is over. All of you get a refreshing tea break now. Please do come back at 6:20 p.m. It would be great if you could assemble in the hall. We have what promises to be a marvelous musical evening with Kalaimamani Dr. Gayatri Girish. She is an ardent devotee of Yogi Ramsuratkumar, and that devotion shows in her music. So please, please do come, spread the word around, come in large numbers, and we will see you all at 6:30 p.m. Jai Bhagwan Yogi Ramsuratkumar. We now request Auditor Suresh, Trustee of the Ma Devaki Patasala of the Yogi Ramsuratkumar Ashram, to please honor Professor Ramanathan. Yogi Ramsuratkumar, Yogi Ramsuratkumar. Please enjoy your tea, and we will meet again at 6:30 p.m. Jai Bhagwan Yogi Ramsuratkumar, and a big thank you to all our volunteers who have been working very hard for the last 2 days in making this program a grand success. Jai Bhagwan.